once a patient is diagnosed with an aortic valve disease, he or she should definitely see a cardiologist. The reason it is very important for us to quantify the amount of disease, the stage in which the aortic valve disease is there, because the treatment of a patient would depend on what stage of aortic stenosis the patient is in. So it is very important once a patient is diagnosed with aortic valve disorder, aortic valve disease, be it aortic stenosis or aortic regurgitation, he or she should definitely see a cardiologist. Many patients once diagnosed with an aortic valve disease start ignoring their disease. The reason why patients ignore their disease is because they are not educated. Patients fail to understand the seriousness of a delayed treatment. So it is very important that one should not ignore the symptoms. For example, some of the patients would say that they are breathless because they have started aging. One simple answer to this dilemma is 6 months ago also the age was same. Let us say a patient is 70-year-old. 6 months ago also the patient was 70 years of age and he was walking 2 to 5 kilometers. But now the patient is not able to walk with the same speed as what he was walking before. That should raise an alarm because the age remains the same, the symptoms have appeared. So we should educate our patients about the type of disease, the seriousness of disease, the outcome of disease if no treatment is done. It is called natural history of aortic stenosis. The natural history of severe symptomatic aortic stenosis is worse than many cancers. Creating an awareness and education would definitely educate the patients to get treatment and consultation on time. Whenever a general physician sees a patient with symptoms of chest pain, chest heaviness, shortness of breath, or syncope, he always consults his general physician. A physician would check the patient and do an auscultation. When a physician auscultates means listen to the patient's heart with a stethoscope, and if there is a murmur, that should raise an alarm. The physician should go ahead and order a 2D echocardiogram, which will give information about the severity of heart valve disease, the function of the heart valve, are there any other valves affected, and is there any other abnormality on the 2D echo. The next test is ECG and certain blood tests to understand the functioning of various body organs. So the most important test for a physician to order if a patient presents with symptoms of shortness of breath, chest heaviness, and on auscultation if there is a murmur is 2D echocardiogram. Early diagnosis of a disease is very important. The treatment is only effective when it is offered at the right time to the right patient. We have enough data which suggests that if a patient has severe aortic stenosis and even if the symptoms have not developed, early transcatheter aortic valve replacement is beneficial in all terms. If the disease stays in body for too long, it can affect the functioning of the heart, which can go down. It can affect other organs like kidneys and liver, and also affect other valves. So it is very important that an early detection, diagnosing the disease, staging the disease, quantifying the disease, and then treating the patient appropriately so that the adverse outcomes or unnecessary complications, prolonged hospitalization, repeated hospitalization, and in some patients even death can be prevented.